Chapter 2. The "it will kill you without surgery" myth. For many years, doctors, parents, and teens have been told that an untreated scoliosis curve is like a ticking time bomb that will surely blow up a young person's future unless it is fused solid inside an operating room. Yet the longest, most careful study ever done on people who chose to live with their curves instead of having surgery tells a very different story, and its clear, surprising results deserve a close look. Back in 1992, a researcher at the University of Iowa began following up with 117 late-onset idiopathic scoliosis patients whose spines had started to twist during the teen years. Year after year, they brought these volunteers back for x-rays, breathing tests, strength checks, and simple questions about daily life. By 2003, roughly 50 years after the initial diagnosis, almost every original participant had reached retirement age, and the study team could finally answer the big question that haunts every newly diagnosed family. What really happens if a curve is allowed to run its natural course? The headline number will stop many readers in their tracks. There was no extra risk of death. The survival rate for the scoliosis group stood at 55%, almost the same as the 57% expected for a group of people of the same age and background who never had a curved spine at all. In other words, having a crooked back did not shorten life by even a single year. Equally eye-opening was the finding that most volunteers reported little physical impairment other than back pain and cosmetic concerns. That phrase means what it sounds like. Aside from the usual achy mornings and a wish that their shirts hung a bit straighter, the average person in the study could work, play, and care for family about as well as any neighbor on the block. Digging deeper into the numbers makes the picture even clearer. Only 22%, roughly 1 out of 5, felt short of breath during chores or exercise, and that risk jumped mostly in people whose curve measured more than 80 degrees and whose highest bend sat in the chest area. Statistically, their odds of breathing trouble were almost 10 times higher than someone whose curve was gentler or lower in the spine. But the key point is just as important. The large majority, even some with very significant curves, could still climb stairs, laugh, and carry groceries without gasping for air. On top of that, everyday strength and flexibility scores overlapped so much between mild, moderate, and severe groups that you could not predict ability simply by reading an x-ray. A 60-degree curve did not automatically doom a teenager to a poor future, and a 30-degree curve did not guarantee total comfort. Personal outlook, muscle tone, and smart self-care played huge roles, reminding us that people are more than pictures on film. These findings carry a powerful, positive message for families facing tough treatment choices today. They tell us that many spinal curves, even some bigger than 80 degrees, do not turn into a disabling disease, and that back pain and body image worries, while real, can often be eased with exercise, healthy weight, good posture habits, and supportive friends, rather than with rods and screws. Put simply, the study punches a large hole in the old assumption that a growing curve must be chased into the operating room before it ruins lungs, heart, and happiness. To appreciate why that matters, think about the advice many parents still hear at their first specialist visit. If your child's curve hits 40 or 50 degrees, you should start planning surgery, because after that point the spine keeps twisting on its own. That warning was built on short-term studies and well-meant caution, not on decades of real-world data. The Iowa research stretches half a century, long enough for teenage volunteers to grow wrinkles, gray hair, and even grandchildren, and it shows that the human body can adapt in ways textbooks sometimes overlook. Another lesson from the study is that lung function decline, when it happened, was usually gradual and small. Breathing tests showed that most values stayed within a healthy zone, even in the severe group, and only a handful dropped low enough to limit sports or busy jobs. The body is amazingly adaptable. Lungs grow around the bend, ribs remodel, and the diaphragm learns subtle workarounds that help keep oxygen moving. Yes, curves above 80 degrees, especially in the chest, deserve close watching and thoughtful planning. But the line between safe and unsafe is not as sharp as once believed. This softer line gives families precious time to weigh options, build core strength, and consider modern, non-surgical tools such as reflexive response exercises, neurotransmitter balancing, and activity-based suits that train the brain and muscles to support a straighter posture. None of these approaches existed when the Iowa group was young, yet most volunteers still did well. Imagine the odds today, with early detection, better nutrition, and science-backed rehabilitation on our side. Why, then, is there still a gap between these findings and the urgent tone some treatment guidelines use? Part of the answer is that surgical studies tend to focus on dramatic before and after X-rays, taken just months apart. A fused spine will always look straighter than a curved one, but a picture cannot tell you how stiff, sore, or happy the person will feel 10 years down the road. Follow-up reports now tell us that hardware can loosen, surrounding joints can wear faster, a problem called adjacent segment disease, and that large operations come with their own risks of infection, blood loss, and repeat surgery. None of this means that fusion is never needed. It simply means that timing, curve pattern, and patient goals must guide the decision rather than fear alone. The half-century record of untreated cases shows a wide safety window, especially for curves under 80 degrees, and a middle ground of watchful, proactive care is often the smarter first step. Of course, no single study answers every question. The Iowa group was mostly white Midwesterners born in the 1930s and 1940s, and medical care was different back then. Yet the project's strengths, prospective design, careful exams, regular X-rays, and a 50-year follow-up rate few modern trials can match, give its conclusions weight. They also remind us to keep asking big, honest questions anytime someone says surgery is the only road forward. Science moves by challenging old ideas and testing new ones, and patients deserve nothing less than the most complete, balanced information available. For the family sitting in a clinic today, the practical takeaway is hope and choice. If your child's curve is under 50 degrees, the odds of a full, active life without rods are excellent. Even in the 60 or 70 degree range, there is room to gather information, strengthen the core, and track growth patterns. And if the curve crosses 80 degrees with the main bend high in the chest, you still have time to consult a pulmonary specialist, try modern posture therapy, and make sure every question about long-term lifestyle is answered before consenting to a life-changing operation. Honest conversations about the real costs, hospital bills, recovery months, potential hardware failure, and emotional stress, versus the real benefits, possible pain relief, curve stability, and peace of mind, are what truly serve a patient's best interests. When all sides of the ledger are laid on the table, and the young person's future dreams stay at the center of the talk, the final choice, whether for or against surgery, becomes an informed partnership instead of a rushed surrender. So when you read frightening headlines or hear well-meaning warnings that fusion is inevitable, remember the men and women in this landmark study who aged gracefully with their curved spines. Their journey proves that scoliosis, while serious, is not a life sentence to misery or fragility. With careful monitoring, smart physical training, and open-minded medical guidance, many curves can be lived with rather than cut out. Their story invites today's doctors and families to respect the spine's natural history, to measure risk in decades instead of degrees, and to embrace a broad toolbox of modern, proactive care before placing permanent hardware. Remember, evidence does not banish emotion, and it is normal to feel afraid when the word scoliosis first appears on an X-ray report. Still, facts are friendly. They calm fear, help clear thinking, and open the door to creative, patient-centered plans. The half-century lessons from Weinstein and colleagues prove that living with a curve is often safer than living with rushed regret. With that reassurance in mind, you can partner with your medical team, ask every question, and choose a path that matches both science and personal values confidently.